Developmental disturbances describe normal structures that have been altered by any number of factors. Many of these disturbances are benign. Others have aesthetic or functional issues that require treatment intervention. We will first talk about disturbances in size. Microdontia means small tooth. Microdontic teeth are easy to detect. Maxillary lateral incisors, or peg laterals, and third molars are most affected. Macrodontia, or large teeth, can appear in isolated cases as pictured on the right. True macrodontia occurs with pituitary gigantism. Many times there appears to be a relative generalized macrodontia when the patient's jaw is undersized, so the teeth seem to be enlarged. Sometimes there are too many teeth. The normal adult complement is 32. These extra teeth are supernumerary teeth. The most common supernumerary teeth are mesiodens, premolars, molars, and usually third molars. Supernumerary teeth can delay eruption, cause displacement of teeth, crowding, and oral hygiene issues. And then there are instances where some or all of the teeth are missing. We have hypodontia, which is the absence of one or more teeth, excluding third molars. The most commonly congenitally missing teeth are maxillary lateral incisors and mandibular second premolars. Oligodontia is the absence of more than 6 teeth. Anodontia is the total absence of teeth. This is usually in cases of hereditary diseases like ectodermal dysplasia. And again, it's familial and hereditary. So here's an example of oligodontia. This is all the teeth that the patient has. There are no missing teeth. The patient simply has a loss of more than 6 teeth. And in anodontia, there's a total absence of teeth. Eruption patterns of deciduous and permanent teeth follow a fairly predictable pattern, although there is a range of normal eruption times. It is pretty much expected that newborns will not have teeth. However, there are instances of natal and neonatal teeth. So neonatal teeth are a tooth or teeth that are erupted at birth when the child is born. Neonatal teeth are teeth that erupt within the baby's first 30 days. Eruption can also be delayed. The slide on the left shows delayed eruption of tooth number 9. It appears that the deciduous central incisor was lost early, allowing thick fibrous tissue to fill in. The correction is to remove the fibrous tissue to allow the tooth to erupt. And crowding may also delay eruption, as you can see in the panoramic X-ray on the right. Impaction will also delay or stop the eruption of teeth. And we're most familiar with third molars, which is what the X-ray on the left shows. But note also on the panoramic on the right, the delayed eruption of the canines due to crowding. Shape disturbances come in a multitude of forms. Dilaceration, the bending of roots, can take on bizarre forms. Dilaceration interferes with extraction and makes root canal therapy difficult, if not almost impossible. The cause of dilaceration is thought to be trauma, delayed eruption, the course of tooth and root development. Parodontism refers to the elongation of the coronal portion of the tooth. This can also be an issue for root canal therapy. Dens invaginatus describes an infolding of enamel into dentin. Due to the abnormalities in the root canal therapy can be problematic. Clinically, there appears to be a deep lingual pit. Because of the depth of the pit, good oral hygiene is difficult, if not impossible. caries in the pit causes access to the pulp very quickly. These teeth need to be sealed as soon as possible to avoid root canal therapy. The opposite of dens invaginatus is the talon cusp. In this case, an enamel protuberance is created, usually on the lingual surface. Talon cusps are not treated unless they interfere with occlusion. However, there is pulpal tissue present in that talon cusp, so any adjustment must be made very carefully. Gemination and fusion sometimes are confusing for students. On the left-hand side, you see gemination. On the right-hand side, you see fusion. So gemination versus fusion. Well, gemination is one tooth bud with two crowns. So if you were to count the number of teeth present in the arch, you would find the normal complement of teeth. Fusion, on the other hand, is two tooth buds fused together with two crowns. So when you're counting the normal complement of teeth, you will get one less tooth. Overgrowth of cementum is generally not a problem. Hypercementosis is the excess buildup of cementum around a root of the tooth. Concrescence, however, means that the roots of the teeth are fused at the level of the cementum. Extraction of these teeth may be an issue, but more so in concrescence. Cervical enamel projections may come in two forms: as a wedge-shaped projection into the furcation of the molar, which you can see on the left, or as an enamel pearl, a rounded protrusion near or on the furcation. These projections create a periodontal problem. Gingival tissue will not adhere to enamel, creating a periodontal pocket. Disturbances in enamel and dentin are almost all a congenital or inherited condition, with some exceptions. Ameliogenesis imperfecta affects enamel, making the enamel defective, and easily chipping off the underlying dentin. Dentinogenesis imperfecta is the opposite condition. This is characterized by defective dentin. I've noted three types here. This is just for your information. But note that type 2 and type 3 have no associated inherited disorders. Soft tissue disturbances have a wide range of manifestation. Lip pits are congenital, and the pits may vary in depth. We all know Fordyce granules, which are ectopic sebaceous glands. Ankyglossia is often called tongue tie. The problems it causes are speech and eating, depending on the size and the condition of the length of the tongue tie. It's easily traumatized, and it does cause periodontal issues. If the lingual frenum connection is placed more incisally, over time it will cause periodontal issues. For that reason, it may be trimmed to reduce the pull of the frenum on the gingival tissues and avoid periodontal complications. Frenal tags are usually found in intraoral examinations, sort of as an incidental finding. Frenums can be traumatized but rarely cause issues. However, in the picture on the right, the frenum extends as a fibrous band, causing a diastema between number 8 and number 9. To close the diastema, the fibrous band is removed and the teeth are moved orthodontically into place. Head and neck bone disturbances manifest themselves at birth. In utero, the face and its bony structures are formed by the fusion of various processes. In the case of cleft lip and palates, maxillary and palatine processes fail to fuse, partially or almost completely. And on the slide, you can see how these defects have been really they're really able to surgically and aesthetically close those defects for the child. So a cleft lip or cleft palate, usually there's some genetic predispositions and environmental factors that may cause a cleft palate or lip. The effects of these defects are feeding. You have to remember that if there's a cleft in the palate, the baby cannot grasp onto the nipple or the feeding bottle and actually create suction to suck milk into the body. Hearing infections, ear infections, I'm sorry, and hearing loss are a problem. Obviously, there's speech difficulties and dental problems. If you look at the complete cleft palate on the far right, you'll see where it can cause issues with dentition. Surgeries for these types of these disturbances are usually the lip at about 3 to 6 months and the palate at 9 to 14 months. So this concludes our brief look at developmental disturbances. Once again, if you have any issues, any questions, please don't hesitate to get in touch with me.